Good afternoon, everyone. I've been considering that for a while. I'd wanted to have a video that's really just only about diabetes. And so I'm going to give a quick presentation on some of the topics that I talk about in clinic. Well, 90 to 95% of type 2 diabetes is avoidable, and a great amount of it can be reversed even once it sets in. So one of the things I'm going to talk about today is briefly why is it that eating a lot of plants is very protective, and why having the animal products is causative in many cases of the type 2 diabetes. So one of my overview pages is this, just again, type 2 diabetes avoidable. Whole food plant-based diet is very, very helpful for that. So plant-based diet, especially with, sorry, I'm getting adjusted here, especially whole foods, is very helpful for treating, preventing, and reversing disease. Why is that? Well, first of all, when people eat a lot of plants, and thank you, Sheesh, then basically it boosts the hormones in the system that bind excess hormones that our body is generating. So those extra hormones that get out of balance get bound up and taken care of. Also, eating a lot of plants helps with preventing obesity. And Dr. Greger has some wonderful presentations on the link between obesity and diabetes. It's not to say that everybody who is overweight or obese develops it, but they certainly are at much higher risk for that. And finally, one of the main reasons why the animal products are associated with type 2 diabetes greatly is that they have contaminants, especially in this day and age. There's industrial pollutants such as dioxins, PCBs, nitrates, and dioxins and BPA that gets in there. I know that when I first found out that arsenic is actually quite prevalent in chicken products, I was quite surprised, actually shocked, and I went over to the USDA website thinking, no, this can't possibly be true. And then I read about several of the medications that are given to the chickens in order to help prevent diseases in the chickens themselves. And indeed so, arsenic was a main ingredient in some of those drugs. Several of those have been taken off the market, but one of the main ones still persists. Anyway, so that is one of the reasons why other chicken products, such as eggs, are actually especially causative of diabetes. In fact, only one egg per week doubles the odds of getting type 2 diabetes. And sometimes people who are basically thinking that only having something such as fish or salmon is a very common favorite will protect them against the type 2 diabetes. Well, part of the trouble with that is, again, we're living in a very polluted world, and the fish is actually one of the highest food sources of PCBs and industrial toxins that we have currently. So that's one of the reasons why eating plants is protective. Partly it's because you're avoiding a whole slew of all of these things. So next, I'm going to talk a little about basically something called a hemoglobin A1C. So if anybody is diabetic or is knowing somebody who's diabetic, the hemoglobin A1C is a very important number to know about. But what does that mean? What is an A1C, and why is it that we check for it? Well, this is my way of diagramming it out and talk about it in clinic. So this is a blood vessel, and right here in there is a blood cell. And that blood cell is a brand new baby blood cell. It's floating around for about 3 months before it gets recycled or destroyed. So it's a really good way of measuring what is going on in the blood over the entire course of that 3 months. So basically, if there is just a little bit of sugar floating around in that blood vessel while the blood cells are floating around in there. Then when we take it out and sample it, then there'll be a little bit of sugar stuck to that cell. And somebody decided that that is going to correspond to a number. Not sure exactly how they picked that particular number to go with that amount of sugar, but however it's done, basically 4.5 to 5 and up through 5.6 is considered to be a normal value. In my mind, in my personal experience, I usually find that somewhere between 4.5 seems to be about ideal for a level of A1C, because most of the time when it starts creeping up a little bit, when it starts going to 5.1, usually 5.2, 5.3, for the most part it generally tends to go up. In other words, the process that causes the sugar to get more concentrated in the blood has a tendency to simply progress with time. So most of the time, if I have somebody who's having trouble losing weight and they're in that 5.4, 5.5, 5.6 area, well, basically what that is telling me is that they are already becoming resistant to insulin, and this process is already starting to happen. So as diagrammed in the beginning stages, there's just a little bit of blood sugar floating around, and some amount of that is normal, so we have a normal value that corresponds to it. Later on, we start to get a little bit more sugar, and I'll bring this a little closer just to zoom in a little bit there. A little bit more sugar, and then you get your blood cell is a little bit more speckled. And then even more sugar, well, guess what? When we sample it, it's even more speckled. And so over on the side over here, I'm going to hide behind my paper for a split second. Prediabetes is where this A1C number is 5.7 to 6.4, and then diabetes is termed as 6.5 and above. And if somebody is checking their blood sugars and just kind of curious as to where they kind of fit in the scheme of things, well, basically, if you check your sugar and it's somewhere around 70 to 100 or so, that usually correlates to about a normal A1C. If the sugars are around 101 to 125, that's starting to get in that prediabetes trend. And if it's 126 or above, and the above, sometimes I've seen up to 400. If people are floating around in the 400, 500, sometimes, and that's enough to get them hospitalized and being treated in the intensive care unit, which you really want to avoid. At any rate, that's a basic explanation of what are these normal numbers, what is the A1C, and where does that come in by. Well, what does this have to do with food? Well, let's get to that in a moment. So the normal thing that happens in the body is that when we eat food, it basically gets broken apart into different sections. You got your proteins, you got your carbohydrates, and you have your fat part of it. And the thing that normally would happen is if everything's working well, the body absorbs that and it breaks down the carbohydrates into these little sugars. And so in this diagram, this part right here is these little sugars floating around. And right here, so this is the blood, and this is one of the muscle cells. And so this is representative of insulin. So how does that sugar get into the cell? Basically, the sugar, it floats around in the blood, and it can't get into the blood cell, into the muscle cell all by itself. It needs to have insulin come along and be like the key that goes into the lock, and basically once it's in the lock, it opens the door. So in this diagram, I've got the closed door and then I've got the open door. So the idea is the lock binds to the receptor, the key binds to the lock, it opens the door, and the door is open and there's the sugar running in, and my little mitochondria here is a happy mitochondria where it's just sitting there burning up all of that yummy sugar. And that allows our muscles to have the energy to move and dance and do anything that you want to be able to do. Also, exercise on a regular basis is a wonderful thing for helping the body to be able to more efficiently move the sugar into these mitochondria, basically energy burning furnaces that goes in there. So what's the problem with the animal products and some of the other saturated fat sources that are out there? Well, when we eat these things, it gets into the muscle cells. Now, this is one of the things that sometimes happens in, for example, people think, oh, well, I'm having a low-fat, skinny chicken breast, and they don't realize that the trouble is that the same kind of fat that gets into our muscle cells is actually in the muscle cells of the chicken already. So let me get back to that in just a moment. So here is the diseased state. So this is now that same picture, and here's your insulin that goes and binds to that same lock mechanism. But now we have this fatty globules. These fatty globules have gotten into the muscle cell, and they're kind of glomming up that lock. So they're kind of like chewing gum sticking up in that lock there. And so the insulin binds, but the key is jammed and it can't get in there. And so because the doors are all shut, the sugar keeps floating around in the bloodstream, and those numbers start to, over time, go up. And underneath here, you can see your muscle cell, yeah, it's got a little stuff it can burn, but more or less it's sitting there saying, I'm starving, brain, get me some sugar. Basically, it's not able to very efficiently to burn up anything here because the sugars are having a very tough time in getting in. In fact, they can't get in at all when the things are glommed up too much there. And so, well, what happens when the body gets too much of the sugar? Well, the pancreas is still down there working, and whenever the blood sugars are going too high, the pancreas starts cranking out more and more insulin. And that insulin is essentially trying to force its way into these muscle cells. Now, mind you, this is a very simplified diagram. There's more than one receptor and there's more than one door, so maybe that extra insulin kind of gets in there for a while. And then at some point, the pancreas just kind of poops out. It can't keep pushing out all this insulin. And that's usually about the point where people start to get into the realm of type 2 diabetes. Usually by that time, about half the pancreas is already kind of burned out, so to say. But anyway, so the sugar, when it's floating around like this, all that extra insulin ends up essentially pushing that extra sugar into the fat cells. So, on the butt or on the belly or wherever the fat cells end up. It ends up pushing it into the liver, and you end up getting more fatty generation in the liver, or fatty liver, is just par and course goes along with the type 2 diabetes. Oftentimes the blood pressure often goes up at about the same time as it starts going to insulin resistance and type 2 diabetes as well. So, and this in a nutshell is one of the reasons why a lifestyle that includes a fair amount of animal products, over time, it takes a number of decades even for this to accumulate and to get into the insulin receptors and to really glom them up. I've got a question here. So does fat accumulate in the muscle cells from too much dietary fat, excess protein, excess carb from the liver, or is it a combination? I would say yes, it's really a combination of pretty much everything. So the too much dietary fat is a huge one in the beginning. Now, an interesting study that Dr. Greger reviews in his book, How Not to Die, basically talks about how it's specifically the saturated fat that is causing these globules to be in there. So essentially, the saturated fat forms these intramicellular lipids. So there's a big fancy Latin word for you, but basically intra meaning inside the muscle cell lipid globules. And so technically coconut, which is also rich in saturated fat, may be particularly binding up in this way as well because it is one of the few plant sources of saturated fat. Whereas if you eat nuts and seeds, those are what we call unsaturated. It's just a different kind of fat type of thing, and it doesn't seem to have quite the same glomming up properties as this does on there. Alrighty, so we've talked a little about how the type 2 diabetes is very much preventable, and this is one of the reasons also why in my personal practice I have a tendency to screen people relatively early. After I finish the presentation, one of the things that I'm going to dig out and put in the comment section below is going to be some of the risk factors for type 2 diabetes and when the American Diabetes Association recommends screening for it. See, in my experience, basically having the A1C as a measure for where somebody is sitting tends to be a little bit of an easier thing to track over time, because when people are eating various foods, basically the fasting sugar, the sugar that's there first thing in the morning, well, that can kind of go up and down with time. Yes, it'll tend to be in one of these camps, normal, prediabetes, or diabetes, but there's a lot more variation in that. Whereas because the A1C is based on something that takes about 3 months to turn over, it tends to be an easier thing to kind of trend. And because it does take 3 months for these red cells to get turned over, that's why it takes at least 3 months of any kind of intervention, regardless of whether it's diet, exercise, or in some cases medications, to make a change. Occasionally, if I've got somebody with a really high A1C, let's say maybe 11, 10, 12, sometimes even 9, occasionally what I'll do is I'll measure that A1C earlier than the 3 months, basically to get a kind of a snapshot of the direction in which it is going, to make sure that my intervention is working. You're in my field there. All right, so basically, as I mentioned before, the main things that tend to be protective tends to be plant products in general, and the things that tend to be causative tend to be those animal products, generally speaking. And as I've mentioned in some of my other presentations, does this mean that somebody has to be 100% entirely plant-based in order to get the benefits of this? Honestly, no. However, the strongest, most intense version of that, which is outlined by Dr. Greger, Dr. Ornish, and others, is usually the fastest, because a beautiful thing happens when people eat all those plants is basically all this glomming stuff that basically is crawling up the receptors and basically making it so that the insulin can't signal, can't get those doors open, can't do anything. Well, when you eat all plants, the body starts to use this up for energy, and basically you're like erasing it from the deepest depths of the muscle cells. This isn't going to regrow your pancreas. That's the other reason why catching it early is so imperative, because if you catch it before it gets into that diabetes realm, basically you're preserving the pancreas from getting overloaded and burned out and all that kind of stuff. So I can't regrow your pancreas for you. So in some cases, people sometimes can't get entirely away from medication. However, as people start to lose weight, as people start to exercise, as people start to feel healthier and become healthier, well, the need for insulin, the need for metformin, the need for all these medications usually significantly, if not entirely, goes away. And one of the things I also warn people is that this diet pattern, if done 100%, is so effective that usually within 1 or 2 weeks, now I'm not talking months, I'm talking weeks, the medications often need to be adjusted. So if somebody's sitting at home and starting to take advantage of some of these resources and the diet pattern and everything like that, then make sure that you're talking with your own personal physician to kind of keep an eye on the sugars and get guidance from them on how to cut back on or how to wean. Because some of these medications are long-acting, like Byetta and such. Basically, there's a shot that lasts for a week, and so you want to do this in conjunction with your healthcare professional. And again, this model of diabetes is not very well known yet in the medical profession. They do agree that the mechanism of this fat glomming up these receptors, that plays a role. However, the solution of not eating that saturated fat is still a very new concept for a lot of physicians. So you might need to direct them to some of these resources in case they want to also learn about it as well. Some of the foods that are especially protective against type 2 diabetes, so plants in general, but I made a little slide on ones that are especially protective, is amla. That's Indian gooseberry. So this is something you can find online. You can find it in some of the health food stores, and it's a very small dose, about a tablespoon once or twice a day can be helpful. It also helps with a whole bunch of other things as well. Next, coffee, soy products in general, green tea, chamomile tea, purple potatoes, and whole grains and beans and other pulses. The next one is vinegar, and then whole food plant-based diet as well. So basically all of those things tend to be especially protective when it comes to preventing and taking care of type 2 diabetes. So, all right, so that's, looking over my cheat sheet there, that's pretty much the bulk of what I wanted to communicate about with the type 2 diabetes today. Is basically want to reinforce that yes, it is something that we can prevent, and also that can be very much taken care of through plants. One of my patients who we had to take off of the insulin very, very quickly, as a matter of fact, because the sugars were dropping so quickly as a result of adopting this lifestyle, basically told me that like 80% of his grocery cart was now full of fruits and vegetables and whole grains and all sorts of good things on there as well. Oh, and that does remind me of another thing. So when people do talk about diabetes, they're often so trained to talk about carbohydrates, carb counting. How is it that we have to measure, all right, this piece of bread is one equivalent of a carb exchange, et cetera, et cetera, et cetera. And we're so trained that carbs are the enemy, that I want to mention that when you basically unglom the receptors, when you get your, when you go from being this picture where it's all glommed up back to being the other picture where, you know, everything is working well again. Well, in the beginning, when the receptors are all globbed up with the fat, then the body really can't handle the carbohydrates in general very well. And when that clears away, when you actually get everything cleaned out, well, basically what happens is your body can put that carbohydrate back into the furnace. And there's a big difference between a carbohydrate being a whole grain, whole food kind of thing, like eating a carrot or eating particular fan of that Ezekiel bread, for example, and just because it's a very good whole grain without any added oils or anything to it, then basically the body can take that and the extra fiber and extra nutrients really sweep things out. Whereas if somebody's eating simple sugars in the form of sodas, candy bars, and that sort of thing, basically that is not very good for the body. And that kind of gets back to the previous question that's in the comments there, because when people are eating, let's say, sodas and high fructose corn syrup, well, it goes into the body and it starts to get converted in the liver into fatty globules that then can go forth and glom things up and cause other problems. I did have a patient once that a long time ago that I started to give this kind of talk to. Okay, you've got type 2 diabetes. We're starting to, you know, when somebody gets the diagnosis of diabetes, essentially almost right off the bat, we're starting them on sometimes a handful of medications, depending on what else is going on. And they just looked back up at me with these kind of puppy dog eyes and says, well, can I just stop the soda? And of course, I'm like, well, yes, of course. And they were drinking quite a few bottles of soda every day. And they ended up doing okay with it all. But it's just one of those things that when people look at the sodas and they look at the, let's say, green tea that's in those prepackaged bottles for the most part, they're thinking they're seeing a beverage. When I look at those things, because of all of what I know about this diet and lifestyle stuff, I look at it and I say, oh my gosh, that's all poisoned in my book, just because it is so darn disease-causing. Much, much, much better to just drink plain water. And if you want to take your water bottle and throw a green tea bag in there or a chamomile tea bag in there, you know, almost anything is better than the sodas and that sort of thing in general. Alrighty, let's see if there's anything else. Okay, so yes, Ashish, I will put down the links to the diet patterns below. I also want to bring out a few other references. If somebody would like to watch a video, Dr. Barnard has a wonderful video on tackling diabetes. He's got a lot of online resources. He's part of the Physicians Committee for Responsible Medicine. He's got some books. This is Dr. Neil Barnard's program for reversing type 2 diabetes. This is a penny on Amazon almost every time I've checked. So this is a wonderful book. It's a very easy way of getting started. Dr. Furman is another physician, same sort of thing. Now remember, every doctor that comes up and talks about these things is going to have a slightly different version or way they're explaining things, slightly different recipes, slightly different emphasis on what it is that they're talking about. One of the, not in this conversation, but a previous thing, somebody wanted me to say the difference between Dr. Greger's, you know, How Not to Die, and Dr. McDougall's programs. So here's one from Dr. McDougall, The Healthiest Diet on the Planet, from Dr. McDougall. And he's also got a book called The Starch Solution. One of the big differences between something like The Starch Solution and Greger's How Not to Die book is Dr. Greger really emphasizes the whole food, plant-based kind of diet, where there's a lot of emphasis on some particular foods that are especially good for not getting cancers, like, for example, broccoli and the whole grains, beans, and so on so forth. Whereas Dr. McDougall is looking at it more from a society perspective and basically saying, you know, human societies throughout the ages have subsided on grains or starches as the basis of their food. For example, brown rice, and later on it turned out to get polished, which is into white rice, which is not basically as healthy. White rice raises the risk of diabetes, brown rice lowers the risk of diabetes, and tastes about the same, so choose brown if you get a choice. But Dr. McDougall is basically pointing out that over the ages, entire foundations of society have based on wheat, on barley, on grains, and so forth. And so that was one of the observations that he made. So he has a tendency to emphasize the starches, whereas some of these other guys focus more on the entire diet pattern, or on sometimes pulling out and emphasizing particular foods that are especially helpful. And last but not least, I want to show Dr. Dean Ornish's The Spectrum on here. Dr. Ornish is another fabulous lifestyle physician and has many, many books and resources and videos and so forth where you can learn more. So again, I'm going to put some of these links as soon as I close out this video into the comment section below. So thank you for watching, and thank you for asking some questions during the presentation as well. So, all right, have a good rest of your day. Bye-bye.